So what is trigger finger? 2 to 3% of people tend to develop trigger finger, and it's a finger that becomes locked after it's bent. So you may hear an audible click as it's bent, and then you usually have to use your other hand just to straighten it again. It's most common in your ring finger and your thumb. What causes trigger finger? If truth be said, it's unknown, but it's thought that it's linked to inflammation, which causes swelling of the tendon or sheath, most commonly around the base of the finger. And the finger operates on a pulley system, so that's why it gets caught, and this gets stuck as you bend your finger, and then having to use the other finger to push it back. The symptoms of trigger finger: you usually get pain around the base of the finger, in the palm of the hand as it catches when it moves. And obviously, as said before, it can get stuck in that bent position, and it's difficult to straighten it without pushing it with the other hand. The diagnosis is made with a good description of the symptoms and careful examination, and this is often sufficient to make the diagnosis. You have observation, obviously, is another way to make the diagnosis, and that's just with visible triggering of the finger. You want to palpate over it as well to sense there's a thickening of the tendon, and you can palpate it also for tenderness and also palpable triggering on movement. So what treatments are available? Well, that really depends on the severity of the symptoms and how long you've had it for. So the first option for treatment is no treatment. Just allow your hand to rest, let the inflammation settle, and symptoms may often recover on their own. The second treatment is a splint. So a splint that sort of goes across this part of the finger and across there, and what it does is it restricts movement at the joint here, so you're just bending that part of the finger, and that can allow symptoms to settle down as well. Just see the photograph up here for a picture of a typical splint. The other one is massage over the tendon, so just massaging over the base of the tendon. You want to do that for about 5 to 10 minutes each day, and often on the pathway to a treatment of a trigger finger, you would try this for about 4 to 6 weeks really to see if symptoms settle down. The other thing you can do are stretches, so that might be with an elastic band, resisting your fingers going that way, and also placing your fingers on a table and just stretching the fingers up so you get a stretch on the tendon underneath. And you can do each one in turn. So you're holding that up for a good stretch and back down. And you want to hold the stretches for about 30 to 40 seconds just to get the maximum effect of a stretch. As said, symptoms may well settle down with that, but if they don't, other options are a local anaesthetic and a steroid injection into the area around the tendon, and that can often reduce inflammation. It's successful in about 70% of patients, but it can be lower in people with diabetes. And a second injection sometimes is needed after a 3-month period, just in case the first one doesn't work. If you have resistant symptoms, it may require a small operation to release the swollen tendon and the trigger, and there's various lists of treatments you can have and the possibilities in the description part of the video below.